Bariatric surgery can change your life, and Dr. Wade Barker has seen it work in countless patients. Though it is a serious procedure, you can reduce your risk of complications by first having a sleep study at a STAT Sleep Center.
Sleep apnea is a very serious problem. It becomes more prevalent as we get older, becomes more prevalent as we gain weight, and the two kind of go hand in hand.
For that reason, there's a good chance anyone needing bariatric surgery may also suffer from sleep apnea.
Our jaw muscle relaxes, and as we breathe in, we create a negative pressure in our airway, and sometimes that collapses, and that stops us from breathing, or it causes us to pause in our breathing, which in turn causes a reduction in oxygen saturation in the blood, and therefore to the brain, to the heart, as well as an increase in carbon dioxide buildup. Those things are basically poisonous to the brain.
But frequently, people have no idea this is happening while they're sleeping.
The problem is, it's come on so gradually, they don't know they're not doing well during the day. They don't understand that their sleepiness during the day, their fatigue, is related to sleep apnea and not sleeping at night.
Other symptoms may include loud snoring, dozing off during the day, or headaches. But the best way to know for certain if you have apnea is to undergo a sleep study.
Now, if at any time you feel uncomfortable, please let me know.
At his wife's urging, Harry Power finally had a study done at STAT, Sleep Therapy Associates of Texas.
As far as coming and having the sleep study done, it was very easy. It was professional techs that work with me. They're so well informed and educated on what they do. They take you step by step. They tell you what they're doing, why they're doing it, and what they're looking to find out for a diagnostic on you.
He arrived at STAT a few hours before going to sleep. With plush pillows, flat-screen TVs, and fancy bedding, it looked more like an upscale hotel than a place for a medical test.
It made it so much better because you're not in a hospital environment. You're not in something that's a sterile environment. I mean, this looks like something that you would have at your friend's house or a nice hotel room when you're out traveling.
Also, with multiple locations throughout North Texas, it couldn't be more convenient.
The results were great, and I was diagnosed with mild sleep apnea, and I have an opportunity to reverse that and to get my health back.
Dr. Barker has made STAT his clinic of choice for pre-surgery sleep screenings.
With STAT, I don't have any complaints anymore. We used to have so many complaints about the conditions, about the way patients were treated, about how uncomfortable particularly women were, and we just don't get those anymore.
And it's critical anyone considering bariatric surgery know if they have a sleep disorder.
It's not a frequent problem, but most of the time, if there are respiratory problems post-op, it's due to undiagnosed or untreated sleep apnea. And my job is to make their surgery as safe as possible. And the reason bariatric surgery is more risky is because of the patients that we do it on, not because of the surgery.
The good news is that most sleep disorders can be easily treated. But again, the first step is to let STAT detect the problem before it becomes dangerous.